Welcome back to this episode of the Law of Relevancy podcast. Today we're really excited to have one of our smartest guests ever, triple board certified Dr. Chris Pittman. Thank you for joining us.
Thank you, Cords. It's a pleasure to be here.
So there's so many people out there, so many physicians who don't even become board certified. Why do it 3 times?
Well, I didn't set out to become board certified 3 times. I set out to become an interventional radiologist, and nobody knows what the heck that is. We're image-guided surgeons, and as you know, I'm a recover and detail guy, so Cords is going to keep me focused. But we have a lot of fun. We basically play video games on people all day in pajamas and sneakers, so all the 5th graders want to do what we do until they find out it's 14 years after high school.
That's terrifying. Could you explain what you just said?
We use image guidance to do surgery. Our specialty invented stents, angioplasty, laser closure of varicose veins, really dozens and dozens of non-surgical procedures that many other specialties have adopted. Radiologists or interventional radiologists did cardiac angiography in the 70s, and then the cardiologists took over. We invented stents and angioplasty, like I said, even the heart ones. But then other specialties take what we do and use it for themselves. So vascular surgeons tend to do a lot of the lower extremity stuff. I'm basically a cardiologist outside the heart, but that really gives short shrift to the specialty. I'm in every organ system in the body. I'm in kidneys, livers, bones, brains, do stroke intervention. It's a ton of fun, but the specialty lacks recognition because we're not associated with a body part or an organ system, and that's a perceptual problem for the Society of Interventional Radiology. We tend to be doctors. Over the last 10 years or so, many of us have started to hang a shingle and do surgery without being part of a hospital group or in a hospital. It's a lot of fun. I'm a radiologist, MRI, ultrasound, mammography, nuclear medicine, you name it, done all that stuff. But we specifically use imaging guidance to do surgery. It's fascinating stuff. We take gallbladders, we drain gallbladders, abscesses. We open up blocked fallopian tubes in ladies who are sterile. We embolize or block arteries to prostate glands to help guys who can't urinate. We block vessels going to the uterus to spare reproductive age ladies their uterus so they can have babies. It's really fascinating stuff. If you're in an accident and you're going to live more than about 2 minutes in the emergency room, they're going to call me, and I'm going to come in the middle of the night, and I'm going to stop bleeding in your liver or your kidney or your spleen or God knows where. So we have a ton of fun. But right now I'm a eucalyptus-eating koala bear. As you know, I'm a bamboo shoot-eating panda, which means I do all day, every day, outpatient venous and lymphatic medicine.
My wife and I just had a little girl. She's only 3 weeks old as of yesterday, I believe. Looking at that ultrasound when we were in our appointments, it reminded me a lot of, I love to fish. And I like looking at the sonar and trying to figure out what kind of a fish I'm looking at. Is it grouper? Is it red snapper? Based off of the way the schools of the fish are and things. But my skills at doing that are nothing compared to what some of these ladies that were reading the ultrasounds to me. Like, how long does it take to learn how to do that?
Well, specifically, you're probably talking about the technologist. So an ultrasound technologist is skilled in the acquisition of these images.
Right.
Obviously they have some diagnostic horsepower, but that's reserved basically for the physicians. Any physician can interpret an image. Mm-hmm. That means the OBGYN can look at these images, but at the end of the day, the true experts are the radiologists. And probably about half the images in the country are not interpreted by radiologists, but we're the specialists in that area of medicine. But to answer your question specifically, it takes about 2 years to become an ultrasound technologist, so not all that long.
Yeah, I mean, I was really impressed because she could locate things with that little baby in utero that were very, very difficult for me to figure out what I was even looking at many times.
It's like anything. Do enough experience and you'll figure it out.
Cool.
Yeah.
So as you were saying, you are a koala bear eating bamboo shoots. You're doing the same thing over and over again.
No, the panda eats bamboo shoots. The koala bear eats
eucalyptus
leaves.
That's right.
Sorry.
No, it's good.
Right.
So you're doing a lot of the same procedures over and over again, which are sclerotherapies, right? At Vein 911.
Well, we ablate or get rid of superficial veins. Most of vein disease is varicose veins. I hate to say that because half of people with vein-related symptoms in the legs don't have varicose veins. So it's there's a lot of misinformation in venous and lymphatic medicine. I got to pack the cannon a little bit, give a little background. It's like discovering dentistry last year. 60 to 80% of us have it. Most of us have no idea. And the unfortunate truth is most of your physicians have no idea that you have it. And millions of unaware Americans suffer from vein disease that they and their doctors don't know about. So as far as the treatments go, unlike a lot of things in medicine, we actually get rid of these vessels. There's two veins types in the leg. The important ones are in the muscle. We don't mess with those. Those are important. Those are the veins that can get blood clots, go to the lungs, and all that stuff that most people are familiar with. But then there's another set of veins under the skin, and those are the veins that cause most people most problems. So those are the veins we get rid of. Vein disease is easy to understand. It's plumbing, simple plumbing. It's leak in the attic, flood in the basement. What we tend to see and feel is from the knees down, but the problems start from the groin down. And if we turn off the leaks in the attic, the flood in the basement will go away. Some of the problems that people have, restless legs, more than 9 times out of 10 comes from undiagnosed, untreated vein disease. Same with night cramps. Swelling is the leading cause of swelling, ankle swelling in this country is far and away vein disease that, again, doctors and patients don't realize. Because this is a newer area of medicine. You can have cramping, you can have burning, itching, heaviness, a lot of different symptoms. If you've been to a doctor and you don't have a clear answer for symptoms in your legs, chances are it's vein disease. So we close veins in 2 different ways. We use heat to close them, and we use chemical to close them.
Why would I want to close a vein?
Because when you have a leak in the attic that's causing a flood in the basement, then you want to deal with the leak in the attic first.
Okay.
So it's pretty simple 4th grade stuff, but that's how you treat vein disease. When blood is going the wrong direction, because blood's supposed to be going back to the heart. Mm-hmm. The only thing that keeps blood from going the wrong way in a vein are valves. And when those valves fail, the blood goes the wrong way.
Gotcha.
And when it does that, it causes a lot of problems. So we can't fix valves, but we can get rid of superficial veins. Superficial veins under the skin are not of any consequence. They take 2% of blood back to the heart, and it's best to get rid of them. And it's, like I said, of no consequence, and it helps a lot of people.
How can you educate the rest of the physician world on the benefits of doing what you do?
Well, without getting too long-winded, you know that I'm a policy expert. I've been doing advocacy in medical and mainstream political activities for 30 years. I've never run for anything that I've been a part of, and I've been a part of many medical organizations. I was asked to lead advocacy at the American Vein and Lymphatic Society about 5 years ago. And a year or 2 into it, I realized nothing would change without a good reality TV show. So the simple truth is it's a newer area of medicine, venous diseases, and it's everywhere. And things change in medicine with glacier-like slowness. Most doctors are focused on, hearts and, high blood pressure, diabetes, all these different things, but they're not focused on vein disease. It's important to know that vein disease is genetic. Mm-hmm. You can eat right and exercise till you're blue in the face. I take care of elite athletes, all sorts of people, some of the folks in most amazing shape. Eyeglasses or contacts affect about 60% of humans, of us. Vein disease affects more than that. And so you can't look down at your legs and say you don't have vein disease. It's not that simple. So we have research to back up many of the things that I said, but it's just not getting out there fast enough.
It seems like in some ways, doctors and medicine itself is pretty slow to change. Why
I would
is
say
that?
very slow. I can't put my finger on it, but you're right. It is very slow to change. It is very slow to change. So publishing more articles isn't going to make any difference. I've done it with my colleagues. It's not going to move things. So I decided at an international meeting in the Italian Alps in 2018 is when it all came crashing in on me. And again, I'll spare you the details. They said, we need a good reality TV show. We need to do grassroots. And frankly, there's no better place than our place. So as you know, we've done a couple of pilots. And with your help and your contacts, I understand it was shot past the pimple popper producers in the last 6 weeks. It was declined, but of course, they're not the only game in town. But also, we weren't gross enough. So we just, believe me, we can be grosser, but we just weren't gross enough. So people are.
I've seen some of the pictures. It's plenty.
I think we got plenty to share, but the 2-minute reel we did wasn't gross enough for them.
Oh my goodness. Well, you are kind of an interesting guy. You've got, obviously you're a very accomplished physician. You're running a practice that has grown to multiple offices. So you're a CEO, but you're a special kind of CEO that a lot of times in CEO school, they teach you to separate yourself from your business. Don't be actually in it as much, work on your business. But as a physician who's skilled at what you do, it's very much a specialty. You're forced to work in your business. How do you manage all of that?
Well, I'm forced for a time to be in it, but most of what I do is leverageable and scalable. But to fully answer your question, I have to go back to the first question you asked about being triple board certified and all of that stuff. So yeah, I'm board certified in diagnostic radiology, interventional radiology, and then I sat for the first year of the boards of the American Board of Venous and Lymphatic Medicine. So I've been certified with them since 2008. There's maybe 1,000 of us, and I was one of the first 200. Again, without getting too many details, there's probably 200 medical specialties, but only maybe 80 are recognized by what's called the American Board of Medical Specialties. So I'm a Diplomate of the American Board of Venous and Lymphatic Medicine, and I'm board certified in interventional radiology and diagnostic radiology. So to answer your question, remember the doctor, man or woman, is always the smartest person in the room, Cords. You've heard me say that before, right?
I opened the show up that way.
Exactly, but now we have to dig deeper. Don't ever forget it. The doctor, can I use her name? Anyways, they're always the smartest person in the room.
Of course.
But through my activities at the Florida Medical Association, I have 25,000 friends in the state of Florida. And I tell them this on the political side. I tell them, you know as much about politics as you did about medicine after your first 4 years of medical school, which isn't very much.
Right. Because
we all go to school, but we learn our trade doing stuff. Mm-hmm. And so we learn how to do what we do doctoring by doing an internship, residency, fellowship, and practicing. What's your degree in? I'm sorry, I'm flipping the tables on you.
Business management.
All right.
And information technology.
But you're doing media stuff. So what doctors forget is they're definitely the smartest person, but they don't have the experience of Cords Owen in media. And this is really the death of them. Because we're trained to be, the buck stops with us, right? We don't check with anybody. I mean, you don't want a teeth-gnashing, hand-wringing physician going, gee, you think it's a good idea to ablate the veins in your legs? What do you think?
No, I want you guys to tell me.
Yeah,
right.
So you want somebody, that knows what they're doing, you know, and knows when to crack your head open or split your chest. So we're trained to be confident and well-trained at what we do, but we're kind of idiot savants, to be fair. You know, we're really good at a narrow area, and being smart helps, but being dedicated and hardworking is probably more important, but I digress. So the problem with docs is they don't respect experience, and they need to. They think because they are smart that they can outsmart Cord Owen at media stuff in a matter of days. They just need to pick up a book. You know, I'm smarter than Cords. I can figure that out. Well, I don't believe that. So I respect experience. I'm close with my accountant, my CFO, my COO, and my general counsel, because to win in politics, it's a team sport, right? Because I spent a lifetime in politics. And to win in business, you would be the first to agree, it is a team sport. You don't do it all by yourself. That's why it's not Pittman Vein Institute. It is Vein 911 Vein Treatment Centers. So I respect experience, and I'm not going to pick on doctors for not understanding business. I could easily say that most people don't understand business, because that's true. Mm-hmm. And I humble myself. Well, not only do I read a lot and have some aptitude, and some track record, but I did humble myself to a CEO group 8 years ago. Actually, I like to say now I belong to 2 of them because I need remedial work. So I'm part of 2 CEO groups just to make sure I get it right, Cords. Yeah. So, I mean, that's been tremendously helpful, because business really, it's a science. There's a science to business. There are certain growth trajectories at which point you're going to encounter pretty predictable problems.
That's true.
And so I read a lot. I have amazing mentors. You're one of them. You know, yeah, mentorship's really important, listening to other people. And I think that's how you end up doing it. You can't, it's not innate. If you think growing business is innate, I don't believe that. Yeah,
I mean, I think you've touched on the exact motivation for this whole exercise in this podcast in the first place, because to me, being relevant is to constantly be learning. You
Absolutely.
Always have to be learning. And for somebody like yourself, what are those places where you're most passionate, where you just find yourself gravitating towards, that you want to learn about?
So tag on there, you change or die. If you're not changing, your business is going south. What am I passionate about? Well, we know I'm passionate about helping the millions of unaware Americans who suffer from vein disease that they and their doctors don't know about. That's what gets me up every morning. But I just have a passion to learn. I'm an introvert. A lot of people think I'm an extrovert, but they haven't met my wife, so it's all by degree. I get excited about teaching and sharing. So at my age, hopefully you know who you are, what you're about, what you like and don't like, and hopefully your strengths and weaknesses, and in some cases your blind spots. So I think I one sentence describe myself in a CEO group exercise, that I am a mentor to others who shares wisdom with humor and without judgment. So I would say that about defines who I am. So we have so much fun in my office, it should be illegal. And you want to go check it out, you go to YouTube. Nothing there scripted. It is completely authentic. But we run a really tight ship. We have an award-winning, world-renowned practice. We're at the top of our game. I'm invited to lecture all over the world. I'm going to Paris in a few weeks to lecture at the French Society of Phlebology.
Is that making a difference, though? I mean, the whole point, the original question was about how...
See, I'm circumstantial. Get me back on track.
How do you make it go mainstream? Is your strategy with your reality show? Well, no. Well, you made the you made the point that you believe a reality show.
Yes.
So going directly to an audience of consumers and just the general public will create enough awareness about.
I believe that's the case. So we have hard business goals. The most important soft goal that I have is making venous insufficiency a household understanding. Mm-hmm. That is a worthy goal of dedicating the rest of my life to, and that's what I'm doing. So the reality show will happen because it has to happen, because every other patient in my office could be on a TV show. So that's where the passion comes from. And what we do in our office is scalable. It doesn't have to be Dr. Chris Pittman taking care of somebody. It was like that by design.
Right.
We are mission, vision, and core values driven. So our mission, of course, is we'll help you feel great again. Mm-hmm. And that's not a job description. That's what we do every day in our office. And our vision for the last 10 plus years is Ritz-Carlton service, Disney fun, FedEx delivery. It should be Amazon delivery because kids don't know what I'm talking about. Anyway, Ritz-Carlton service, Disney fun, FedEx delivery to be America's choice in vein care.
That's a noble goal.
That's the vision.
Right.
And as you know, we have a sister company that is the largest independent network of vein physicians in the country. So it's really cool when you start out with a mission and vision, and you and an MA and some other employee, and by golly, you can taste it 10 years later.
So what's the difference between what you're doing with your cohorts in the vein industry and some of the consolidation that's going on in medicine right now?
What are we doing compared to them?
What is the difference between what you're doing with HPS?
Okay, well, HPS is Health Performance Specialists. It is the largest independent network of vein doctors in the country. I'm very proud of it because I don't buy doctors. I don't go in there and do my due diligence. They're on the canvas waving the white flag. They can't stay in business anymore because it's very hard to stay in business in healthcare if you're an independent practitioner. What we do is we go in and we help, in most cases, successful practices, but some of them are starting from scratch and some are struggling a little bit, and we help them to survive and to thrive. And we profit share a little bit from that. It's a subscription fee, but we're of a size now where we save a fair amount on consumable items. We obviously share a lot of intellectual capital on the business side of venous and lymphatic medicine practice, but also services. So we're pretty darn good at revenue cycle management. We can do anything, and as you're aware of, we're going to be rolling out a media division because, we need driving leads is really important in vein care. The unfortunate truth is most patients are self-referred, and they should be referred by their doctors, but they're mostly self-referred. And so we need to be really good at driving leads. So there's no other model like it that I'm aware of. It doesn't exist. So I'm very proud of it. It's not easy to do, but we've done it so far.
Has the vein care industry, that specialty, has it been able to resist some of the consolidation to this point because you have a limited number of insurance codes, or what are some of the reasons why there are numerous vein clinics that are living outside of a consolidation type effort from hospital chains and things like that?
Well, that's a good question. And I give hours-long policy talks and stuff, so I will try to be very terse. The landscape in medicine depends on local regional circumstances. So we get paid the less for example, of 20 plus practices, 30 locations, 10 plus states. So if I can do it in Tampa, Florida, I can do it anywhere.
What do you mean you get paid the least?
It's all based on market. It's all market driven. So everybody wants to live in Tampa, Florida. It's desirable. there's a flood of physicians here, and so that drives down reimbursement. It's simple supply and demand. If I wanted to go to Little Rock, Arkansas, Mississippi, Wyoming, or Montana, I would have no problem doubling or tripling my revenue. None at all, doing the same darn thing.
Like big fish, small pond.
Yeah. So, well, it's because there's not a lot of market penetration with payers and managed care. So what goes on in medicine is really a pretty local, regional thing. And I like to back up my opinions with all sorts of examples, but I'll spare you from that. But that's the honest truth. And it works the other way. You got to be careful. You could be doing really well and think, drink your own Kool-Aid and think you can reproduce it somewhere else, and you can't, because you fail to understand the local, regional politics and atmosphere of medical payment and referral patterns. So it depends on, if you have a dominant health system, a dominant payer. For instance, in Alabama, 80% of the payer mix there is Blue Cross.
Right.
There's not. So it's really, it's a little different in different places. And so anyway, I'm not sure I answered the question fully, but that's part of it. Some practices are doing amazing. Some are doing really poor. It really depends on their circumstances. But I wouldn't say I'm a contrarian, but we definitely think differently. I think, again, I pick on doctors because that's who I hang out with, but I think it applies to all humans. We all focus on what we're paid. What am I paid? What's my salary? What's my hourly? But there's always a denominator, right? So one thing you can be sure of in medicine is you're going to get paid less than the year before. It's been happening 40, 50 years. So when my doctor buddies moan and complain about, hey, we're getting paid less again this year, I'm like, well, where have you been for the last 10 or 20? You already know that's going to happen.
I detect a trend. Yeah. Well, some people are getting, some people are turning it around.
Well, when you say turning it around, what a lot of doctors have done is they have come under one tax ID.
Right.
And then they're the 1,800-pound gorilla. Like, I think there's only one independent OB practice left in Tampa Bay. It's either one or two big roll-ups. And because those payers need OBGYN services, the OB consolidation company is able to drive up the payment. But where's the value in that, right? It's like it's an arms race, right? So the bigger I get, the more I can charge you, but there's no value to the consumer in that necessarily, right?
Well, let's talk about that for a second, because from what I've learned
that's what's been going on in this country for years now.
Yeah, absolutely. I mean, it's definitely a mature market, and there's market forces at play. So what I've learned about specifically some of the work that you do is different from some of the other vein care that's available at some of the other places, some of your competition, right? You do a ultrasound guided, because you're interventional radiologist, ultrasound guided foam sclerotherapy. So you're injecting the vein with foam, right? You're not doing a veinectomy.
Correct.
You're not doing some of the more traditional approaches. It's sort of an innovative approach. But because it's innovative, then the insurance companies don't understand it as much. Your reimbursements, I assume, lower. Tell me if I'm getting this wrong.
It's all right.
Your reimbursements lower, but your results are better. Mm-hmm. So how do you? Because I've met many physicians, and like you were saying, your buddies complaining about not getting paid more, or that the trend is they're getting paid less. How did you go down this path? Because it seems like the morality of it is very strong. How did you go down this path of choosing a technique where you get reimbursed less, people don't understand it, and there's other people in your field who are doing more invasive methods that are, it seems like it would be very tempting to go that route to get paid more. seems like a lot of the people I know that are physicians, a lot of times, especially depending on their mortgages and cars and things like that, hobbies, will go down that route.
Boy, have you unpacked a lot. Anyway, yeah, but I'm just not that guy. So I'm the only vein care luminary, nationally and internationally known, that is willing to talk about something that they don't get paid for. Much to the chagrin of my stingy CFO. I'm kidding. Because we're going to do what's right for patients no matter what. And we'll do well because we do that, and we will do even weller as we move forward, which I think you're going to get me into here shortly. But yeah, most luminary doctors are paid what the medical industrial complex asks them, or speak about or promote those things that big companies ask them to speak about. and so a lot of big shot doctors in any field who speak from stage and so on and so forth, many of them are subsidized with the research and this and that by what I call medical device companies, pharmaceutical companies, or the medical industrial complex. And the simple truth is we don't get paid for ultrasound-guided foam sclerotherapy, even though it's the future vein care available today, because billion-dollar companies don't get rich when I use it. And so when I do a thermal ablation with laser or radio frequency, one of the largest healthcare companies in the world makes several $100s.
Right.
So I'm just an assembly line worker in some ways working for a medical device company. And so again, I know too much about this because I'm a policy wonk and all of that. So you don't get rich doing foam, but you get rich because you take good care of patients. And I can take care of patients the rest of their life that most doctors, vein doctors, can't because they don't do foam. And without getting into too much detail, you cannot meet the needs of a vein care patient unless you do foam sclerotherapy. Period, check, end of story, because it's a tool you need in your toolbox. And I love the dental analogy. It's pretty stupid to go to the dentist once in a lifetime, and you don't want to go to the vein doc once in a lifetime. But unfortunately, most of the vein docs out there will do their procedures and then discard the patient. But just like the dentist, you're going to need some treatment in the future, and the highly reimbursed, more simple procedures aren't going to meet the needs of those patients. So I've just been doing it the right way for 17 plus years. And with the way healthcare reimbursement is changing, it's perfect storm, because we've been shifting from what's called fee-for-value medicine to fee-for-service medicine to fee-for-value medicine.
And that change is happening right now.
Oh, it's been happening for a decade, ever since.
That's new.
It's new and it's not new. And again, without getting off into several hours of policy talk, Medicare Advantage plans are basically Medicare replacement plans where basically they take $1 from the federal government and deliver 50 cents in care,
Sure.
The risk of being crass. But Medicare Advantage plans have been around for decades, probably since 90s, something like that. And so the government codified that basically in Obamacare, which was passed in 2010. And it's been growing. And it's a sea change difference. So right now, the more I do, the more procedures I do, the more I make. On a fee-for-value side or value-based medicine side, the less I do, the more I make. It's a bit of an exaggeration, but not by much. You as an entrepreneur, the more services you provide, the more you get paid. Imagine getting paid for the value you provide.
I actually worked at an agency like that once, where they would negotiate a large fee up front with the client. Mm-hmm. They would promise on deliverables, we're going to deliver these things, and they never told the client necessarily how the sausage was made, and they were always under pressure to do everything as cheap as possible, which and if they did it cheaper, they would make a higher margin. So it was an all-inclusive marketing model. Haven't really heard about that too much other places, but I did work at one once upon a time that was like that. It reminds me of your model that you're talking about, and you're specifically, like, there's an acronym for that, right? ACO?
Well, that's a federal acronym, is an accountable care organization. That's where you're taking care of a population of Medicare patients and trying to drive down the cost. And it's pretty simple to do it. You're benchmarked. There's a certain amount of money that the government knows they spend on, every patient every year. They benchmark you, and if you can lower that spend, you profit share. The commercial version of that is called, or with a commercial company like Blue Cross, Aetna, Cigna, Oscar, and others, is called a clinically integrated network. I'm a managing director of one, the only physician-led one in the Tampa Bay area, over 200 doctors. 90% of the money goes to primary care, but we've made well over $10 million for the physicians. But that's a commercial version of it. Make no mistake, patients aren't getting poor care. It's just doctors aren't traditionally paid to lower the spend. We've never, we don't determine how we're paid, right? So, again, a quick digression. You hear a lot of bad things about the doctors. You don't hear many bad things about. There's a triumvirate in medicine. There's the payers, the insurance companies, the hospitals, and the doctors. You hear plenty about doctors. Perp walk this, fraud that. I assure you, there's plenty of fraud that is in the papers and from hospital systems and payers. It just doesn't get promoted that much. You know why? Because payers and hospitals are some of the biggest employers in most areas.
Right.
And they buy advertising. You follow me? So the media doesn't bite the hand that feeds it. So it's real easy to pick on the doctors. I'm sorry, I had to say that.
I think you've said a lot. As you're describing the different models, you've got the ACO model, you've got the fee-for-service model, and we talked about how you're doing a procedure that you're not getting paid on the same level as your competition is for doing a more, like, I keep wanting to say a word like archaic. It's a more like dated. It is. It's the diesel version, of the procedure, right?
There's no role for surgery and vein cure. Friends don't let friends get vein surgery, and these are they call it in-office surgery. It's called phlebectomy. And anyways, I'm very public about that being a garbage procedure.
Right. So
and I can back it up.
I guess I'm just in general, and we're talking about just the field in itself. Does it make sense to go to a physician-owned clinical practice like yourselves, because the incentives are there to just provide the right amount of care, the right treatments? You're not getting pressure from a hospital CFO to do X number of procedures or that sort of thing?
I think, look, I've been protecting the profession of medicine my entire career. I'm past president of the Florida Medical Association's Political Action Committee. It's part of my fiber, but I'm also dedicated to preserving the independent practice of medicine. And I don't think I need to answer that question I can just tell you this. Most doctors are employed in this country.
Right.
And if you think that they're all thinking independently and without undue influence from their handlers and the people that pay them, then I got a bridge to sell you. So you follow what I'm saying?
Yeah,
you're gonna do. Does the young lady helping us out in here do pretty much what her boss asked her to do? Pretty much.
Most of the time.
Pretty much. Most of the time.
Right, of course.
But do you want your doctor not working on your behalf even 1% of the time? Yeah. Well, hell no.
Yeah.
So am I saying that's happening with every employed doctor? No.
I'm just thinking it's common sense. Based on incentive systems.
It's a profession. This is not medicine's not a business. There's a business aspect to it. It's a profession.
Right.
And now everybody's a professional, right? I'm a professional, this, that, whatever. There's 3 learned professions: law, clergy, and medicine. And semantics is important, but you take an oath to a patient.
That's true. You do take an oath. Right.
You know why you call me Dr. Pittman? I'm sorry, I'm turning the tide on you. But you know why I call priest father and all that stuff? You know why people call me doctor? Not because, I care and I need my ego massaged. It's to remind that person that what they do every day is not just a job. It's actually a reminder to me.
Never heard that said before.
That's exactly what it's about. Because there's lots of doctors, PhD doctors, and I respect them. I've worked with them. I've done bench research. They deserve to be, doctors. They've done their training. But a medical doctor is reminded that constantly because they're not punching a time clock. It's different. Should be.
Yeah.
Should be.
I think back to the days where there wasn't necessarily a doctor's office. There was, a doctor who was taking care of a small town, and they would show up at your house with a bag and do some diagnostic things.
Yep. And whether you pay or not, they took care of you. My dad was the first neurosurgeon at Morton Plant Hospital in Clearwater. They used to pay him and, free car work, haircuts for 5 years, all that stuff. I'll barter with my patients sometimes. I got a nice thing of cigars the other day from somebody. So I do that stuff all the time.
That might be a better deal.
Yeah.
That might be a better deal.
Yeah, so, you can't turn a patient away because they can't pay. That's not how you do it. So,
no, of course not. Of course not. But I'm just thinking in terms of incentives and control over what you're doing, it seems like it is a good idea.
The fee for value part?
No, to see a doctor who has complete control over your care.
I would think so. Again, generalizing and being too stereotypical can be a problem. But in general, yeah, I think it's better. I think any doctor who's still independently practicing, frankly, is self-selected to be a better doctor and probably a better business person, but probably a better doctor because they can generate referrals they need and so on and so forth. And again, it's a generalization, but it is not easy to stay in business. But every doctor in America will not be employed. That is not happening.
Right.
There will be plenty. In fact, it's likely to shift the other way. People who are way older than me it goes back and forth. So right now they're all employed, and in the next 10 years there'll probably be a mass exodus back the other direction.
Well, it is fun watching what you're doing, and I do find it quite intriguing to see all the different places where you are spreading yourself out, and you seem to be pretty effective in all those places. But speaking about cigars, tomorrow night you might be passing some of those cigars out because tomorrow night
I thought you had the
election.
baby.
Tomorrow night is an election that your wife is running in, and she has a good shot at winning.
I think she's going to win, yeah. You want me to talk about that? So, we've been doing, we were dating at political functions 30 years ago. Was it 30 years? Yeah, almost 30 years ago. Yes, I've been in mainstream politics a long time. It's been a ton of fun. We never, ever once sat around saying, when are you running? When are you running? When are you running? Anyway, she was recruited to run for school board about 14 months ago, and that morphed into state house, and she is very likely to be the next Florida State House of Representatives member from District 65 here in Tampa area tomorrow night, very likely. So she's a great candidate. Really, because I'm pretty objective about politics. It's best understood devoid of emotion. But she really is. She's a good candidate. I've been trying to dig dirt up on her for 30 years, and I can't find any. It doesn't exist. She's charming, but you don't want to cross her.
Well, that's pretty exciting, though, right? I mean, if it's been 30 years, you've always had politics be a pretty important part of your life. Yeah. That's got to be pretty cool, seeing that your partner.
It's a little surreal, but it's, we've had plenty of negative campaigning. We just laugh at it. She was dressed up as in a hazmat suit. She was dressed up as a Grim Reaper, and she looked cute in every one of them. Yeah, I just laugh at it. So we've been involved in it for so long, pretty thick skins, but it ain't over till it's over. So, you have to have a good showing, good turnout. But yeah, she's going to be an excellent candidate, and we're wise and about that kind of stuff. And kids are all in college, so mom's going to have a lot of fun. And there's two kinds of politicians.
You're, an empty nester at the end of this year?
Actually, already, our twin boys are at USF. Yeah, there's two kinds of people in politics: those who get into it to advance themselves, and those who get into it to make the world a better place. And she's definitely in the latter category, because she's given up a lot to do this.
Mm-hmm. How about you? How's it going to change your life?
Not at all. I'm busy as hell trying to stamp out ignorance about venous and lymphatic medicine, right? So we both have important jobs to do. We won't miss a beat. I'll drive her car, call her honorable.
That's fun. That's fun. Gosh, so just to get back to some of the venous care conversation for a minute, one of the things we actually met, over a decade ago, I believe now, and it was in a marketing meeting. And you mentioned earlier about how vein care clinics need leads. Mm-hmm. You've been pretty dialed into the marketing game for a while when it comes to medicine and how to create awareness and drive appointments through advertising. How has that changed over the last decade?
Well, I can talk for us personally, but again, a lot of these answers have to do with the local medical marketplace. Look, we did Google pay-per-click for years, and I think it worked pretty good. I think that's harder to do now. They say a good practice is 33% word of mouth, 1/3 doctor referral, 1/3 marketing. I think when you're at our size, you don't want to put all your eggs in one basket. Mm-hmm. And you've certainly enunciated this before. There has to be some degree of branding. You need to be in multiple media venues. So we have a whole flight of TV ads starting 2 days, 48 hours from now. So I think you do some TV. We have a physician liaison, which I think works very well for a lot of practices. It's a little tougher in a consolidated marketplace because doctors who are owned by the payers or a hospital system or a large multi-specialty clinic, they're incented to refer
they have
to
a built-in
own
pipeline.
Yeah. Right? So if you're an independent vein doc, which I basically recommend, it'll be a struggle if you're trying to get doctor leads in that kind of environment. But we've got physician liaisons that we use. We do pay-per-click. I think SEO is important. I think social's important.
Are you saying that you've become more diverse with your marketing efforts over the years?
I would say we become more diverse with our marketing efforts. Yes. You can go to health fairs and these kinds of things. I think every little thing helps. And of course, like any well-run business, you need to track your ROI. And, notoriously and for a long time, it can be challenging to track ROI in media, but it's not impossible. And although it may be imperfect, it can be done.
Sure.
And it's important to note that you're getting return on investment for your media dollar, no matter where you're putting it. Mm-hmm. So, or you'll promptly go out of business, right?
Of course, yeah.
Yeah, I would say we are way more diversified than we were even 5 years ago.
It's definitely been more of a challenge just across the board with as fragmented as people are. It's very difficult to get very efficient impressions and reach and frequency within channels these days.
And we can't discount the effect of COVID, people totally changing how they live their lives, what's important to them, inflation. A lot of venous stuff is discretionary. People can put it off if they want. So I think that's probably made it a little more challenging over the last 3 years as well.
So before we go, tell us again, how would I know if I should see you or a vein doctor? How would I know? What would I be feeling like? What would my symptoms be like?
If you have any itching in the leg that no one's been able to explain adequately, or itching that doesn't go away no matter what they've prescribed, could darn well be venous. If you have leg cramps at night that wake you up, the chances are 9 out of 10 it's venous. Again, you can say I'm crazy, but I'm not. Restless legs affects about 8% of us. It sounds like a ridiculous disease, but a lot of people suffer from it.
Is that what you're talking about?
Well, night cramps where you actually wake up during the night with a cramp, and you got to walk it off sometimes. If you have a leg cramp once a week, the chances are you're having it every day, but you're not totally waking up. I think most people are familiar with sleep apnea. I'm going to make an analogy. Sleep apnea is where you're choking on your soft palate all night long and you're not getting oxygen to your brain, and it causes increased risk of stroke, all sorts of things, overweight. And so we have these CPAP masks. I would submit that restless legs, if you is keeping you up at night and interfering with your sleep, night cramps interfering with your sleep. So when people have those two entities, I'm really excited about it because I know I'm going to cure it 9 times out of 10. They're going to sleep better. They're going to have more energy, more well-being. They're going to lose weight. We kid around, they're going to win the lottery. It's really life-changing. What is really pretty remarkable is how lower leg or lower extremity or leg venous disease can affect the entire constitution, the entire body. So swelling. Don't let any doctor at any age tell you that swelling is a normal part of the aging process. It is not. It is far and away undiagnosed, untreated vein disease. Number 2 cause is going to be medications. And then many people are familiar with heart failure and organ failure. That is way down the list, way down the list. What do most primary care doctors do? They say, oh, you got swelling, here's a water pill and quit eating salt. I'm telling you, that's not the answer. It's venous disease. Come in and get an evaluation. So those 3 things have nothing to do with a bulging varicose vein, restless legs, night cramps, swelling. Itching, we covered. Heaviness in your legs, burning, tingling, even neuropathies, okay? A lot of folks as they age, especially diabetics, get something called peripheral neuropathy. I'm not going to sit here and say I can cure diabetic, peripheral neuropathy. However, a lot of tingling, burning, and neuropathic-like symptoms in the legs are actually venous related. One of our keynote speakers is a leading referrer to our practice. He's a neurologist. I cured him of his restless legs, and he is subspecialty trained in neuromuscular neurology, and he had no idea that venous disease can cause restless legs. He was a keynote speaker at our Congress 3 weeks ago in New Orleans that I was chair of. And we, as a sidebar to that, we are going to be opening a restless leg center of excellence because there's a lot of people that suffer from it, and they're never going to connect that it might be from vein disease. So I would say those are the major symptoms. But any symptom in a leg that your doctor has not been able to adequately explain, or it just won't go away, we have saved people from knee joints, hip joints. There are some orthopedic issues that are actually venous. There are some things that people think are their sciatica that is actually venous. So the 3 very common things in humans from age 20 on is arthritis, sciatica, which is pinched nerve, and that can affect anywhere from the lower back to the tip of the toe. and then venous disease. But it's venous disease that nobody pays any attention to. And I guarantee you, there are many thousands of people going to neurologists, orthopedic surgeons, chiropractors, neurologists, others, and all they have is vein disease. So that's our mission, man. You got to stamp out that ignorance.
Yeah, for sure. I mean, that's just surprising to me that
It is. It's surprising to me. It absolutely blows me away how common it is, and we don't know about it. So when people ask me, really, it's like dentistry? I said, yeah, you're getting rotten teeth under the skin of your legs, and you don't know about it.
So where can people go to follow you or to watch your pilot for the show that
you
you're
go to
talking
YouTube. Obviously, you can go to vein911.com. We do a lot of live videos on Facebook, but if you want to see how we roll in some patient vignettes and how, I just go to YouTube and check out some of those videos.
Yeah, I've seen quite a few of them. They're pretty informative. I was shocked to learn all the different ways that veins may be entangled with some sort of a condition or whatnot. It's pretty surprising.
It's crazy. Again, when it's affecting 60 to 80% of us, and all we did was pick the wrong parents. Again, you can be in bad shape, you can be in excellent shape. If you're going to get it, you're going to get it. It's like glasses. I can eat all the carrots I want, but if I need glasses, I need them.
Yeah, well, we'll definitely follow you there. And you can follow us anywhere where podcasts are found across all of our different platforms, the bakemorepies.com website, the lawofrelevancy.com. And we will see you next time. Thank you for joining us.